Thank you so much. First of all, I want to tell you how happy I am. First of all, I'm very happy to be in Israel. Second of all, I'd like to thank Dr. Bayer, Dr. Skorecki. It's my first time at Rambam, and I've been a participant in the summit, and I got to see the incredible work that you do. And I'm going to go home with many stories. I have a much easier job than my friend Eric Amster, because he was talking about the future planning, looking at studies, trying to figure out what's going on here. And I'm going to talk about what we learned. And I think what we learned applies very much to the kinds of things that you're talking about. I'm going to also talk to you a little bit about the overlap between medicine, science, and politics and our mayor. I didn't realize some of the things that you spoke about, and I can only say that we were very happy with Mayor Giuliani after 9/11. But when you hear what I'm going to talk to you about, we might have been better off with your mayor. Okay. All right. So first of all, a lot of people don't know what occupational medicine is. Eric and I talk and we say we're occupational physicians, we're environmental physicians, and many people don't know what it is. So I just want to spend 1 minute explaining what it is, because it's a very unique specialty and it's different from a lot of medicine. It's actually a subset of preventative medicine. So I had an excellent tour of your incredible oncology center here. We don't actually do a lot of treatment of cancers, but we try to prevent cancers. Okay, so it's a subspecialty. We learn all kinds of things: industrial hygiene, epidemiology, preventative medicine. It's actually a fellowship that you do after training either in pediatrics or internal medicine. And you come out a very unusual doctor. We have residents that rotate through us, internal medicine residents. And I think they're always amazed. They usually come to me after a month in ICU. I tell them it's because they need a rest. But they spend time with us, and we're physicians, but we're also scientists and investigators. And we also have the pleasure or the challenge of very often working with local politicians and national politicians. We've worked with the White House, we've worked with the senators. Because what I've found, in order to protect health, doctors can protect health in a few ways, but working alongside politicians and community leaders and business leaders, whether it's in a factory or in a community or in a national panel, that's the way to get people from being sick. So I'm actually here to tell you a story, and it's quite a fascinating story. And you might have read snippets of it in the newspapers or seen it around September 11th. There's always TV shows and articles all about the health effects. So some of you may know about it, some of you may not, but it's actually a fascinating story. And I think that from this story, we can take what we learned and apply it to the future here in Haifa and all over the world. Okay, so first of all, a little bit of a commercial. I came here, and I spent many times here. I think it's my 30th trip. And I've done work here, I've done consulting here, and I did some training here. And it's my first time at Rambam, and it's interesting that Rambam is the only hospital in Israel that can provide occupational environmental medicine services. And it's a real statement of your foresight, in my estimation, because many hospitals don't have the foresight to gather the expertise that you have here and provide services both to the community and to industry as well. Okay, so environmental disasters that we'll talk about, there's actually two kinds. There's the natural environmental disasters, then there's the man-made environmental disasters. Natural environmental disasters are quite unpredictable. The best example is in the 1980s. Some of you may remember there's a lake in Africa where there was a cloud of carbon dioxide because of geologic changes. It was shot out, and it had very unusual pH, and thousands of people died, and tens of thousands of cattle died. So that's an environmental disaster. We had an environmental disaster in New York 2 or 3 years ago. We had Superstorm Sandy, right, which was a hurricane, and it knocked out the power, but the environmental impact was very interesting because of the mold that developed as a result. And unfortunately, that mold created asthmatic-inducing conditions for the same responders that I'm going to tell you about in 9/11. So those are environmental. There's not much you can do to prevent those. And then there's man-made environmental disasters. And the best studied, and probably the biggest one that we've had in American history at least, is the attack of 9/11, which many of you probably don't think about as an environmental disaster. You think of it as 9/11, but in my clinic we're still dealing with it. We have 60,000 patients who are sick today because of the events of September 11, 2001. And the question is, could we have stopped that? Could we have prevented it? So the lessons that we want to take away today are understanding mechanisms of toxicity, preventing disease and mortality, but I think most importantly, it's for doctors and scientists to work together with politicians in order to prevent disease. Okay, so as I said, it's the largest disaster in American history, and at this point there are more deaths from the long-term exposures than there have been from the acute attack. So what happened on 9/11? Everybody remembers where they were? And everyone remembers that day. It was a very sad day for all of us. The way I got involved with this, by the way, is I was trained in environmental occupational medicine, and I used to travel all over the world, actually, go into factories, being called in for chemical exposures. And fortunately, I lived a mile from ground zero. And so I had the largest toxic event in walking distance from my house, and that's how I became involved. So what were the results of the attack? The results of the attack was 16-acre disaster site, 3,000 dead. And, you know, people talk about the 3,000 people that died on 9/11. I'm sure you know, or you may not know, that over 50,000 people were rescued. Okay, and it was an incredible rescue. And a lot of these people, I get choked up when I think about it, a lot of the responders were my patients, and they tell incredible stories about walking up 70, 80 stories to help people down. So what were the releases? We know that there was asbestos only in one of the towers, and the reason it was only in one of the towers was because my old chairman, Irving Selikoff, who showed that asbestos causes cancer, he was walking with the mayor. See, it always comes back to the mayor, no matter what you do. He was walking with Mayor Lindsay, who you might remember, and he was watching them spray asbestos on the first tower, and he spoke with the mayor, and they stopped it, so it was only on one tower. 5,000 tons of an asbestos type called chrysotil, which is a Quebec-mined asbestos that causes cancer and other conditions. There were tons of concrete, and there were tons of particulate matter. Okay, what else was there? There was everything that you could imagine, including substances that we didn't even know existed, because when you took the heat and you took the mixtures, chemical reactions created things that we didn't even know about. But when we think about the things that we do know about, it was almost like innocuous objects that became poisonous. When you think about a computer, the old computers, and it's hard for me at my age to think that 2001 was old, computers used to contain lead. So if you crush one computer and you get a little bit of lead, it's not a big deal. If you have 2 million computers and you crush it, you get a lot of lead. Halogen lamps they contain a trace of mercury. If you take 3 million halogen lamps and you crush them, you're going to get mercury in the environment, both in the ground and in the air. Dioxins they're substances that come from fires. We know they're carcinogenic. There are things like PCBs that are in capacitors that we also know are carcinogenic. And then there's asbestos. There's also particulate matter, which is something that Eric was speaking about. Particulate matter was probably one of the biggest culprits in terms of the exposures of 9/11. And what it is, as he said in French, I went to school in Quebec for college, and in French we call it schmutz. So there was a lot of schmutz there, and unfortunately the schmutz had a very, very low pH. Okay, and it actually burned through both the respiratory systems and the GI systems. And we're dealing with those results today. We're seeing both asthma and GERD, as well as sinusitis. I was going to say, how long do you think the fires went on for, but it's on the slide. I do that to the students, the medical students, all the time. I have the answers on the slide, and then I ask the question. Fires actually went on for over 4 months, until 2002. There's all kinds of interesting stories about what was under the towers. There were freon tanks, and a lot of this wasn't known. If the fires would have reached the freon tanks, we would have had a huge crater in lower Manhattan, and it was through heroic efforts that it didn't happen. When I talk to my patients, I say, you get very naive in occupational medicine. I said, you wore a mask, right? And they say, no, and I say, why not? And you get a few answers. Most of the time they were told the air was safe and there was no need to wear a mask. Even those that thought the air was not safe, you talk to a lieutenant with the police and you say, did you wear a mask? And he said, if I was wearing a mask, how could I shout orders to my men? Okay, or you talk to a canine cop, which are the cops with the dogs. How could I speak to my dog? So it's very, very low use of respiratory protection. There's a study that we're planning to do. There was one company, it was one of the utilities, that strictly enforced the use of respirators at ground zero. And they have a very, very low incidence of disease. So we do know that if you can protect people from breathing in stuff, you can keep them from getting sick. The other thing, there's a lot of guilt. I'm not a psychiatrist, but most of my patients have psychiatric conditions, so I become a pseudo-psychiatrist, which sounds like a psychiatric condition in itself. And you spend a lot of time talking with them, and they say, Doc, how could I wear a mask? My brother, firefighters especially, they're brothers. And my brothers were there. Why would I worry about myself? And as a result of this, we have 20% of firefighters that will not work again because of their respiratory problems. Okay, and these are examples. I'm sorry if they're a little bit gory, but these are examples of the kinds of conditions that these people worked under for months. working 18-hour days and sleeping in their clothes, like wherever they could. And you don't see many people wearing respiratory protection here. Having been down there on the 12th myself, the thing about the medical community as it is here is we're very responsive to emergencies. There were so many doctors that went downtown that when a firefighter had a speck of dust in his eye, 3 ophthalmologists would jump in to treat him. And finally, the administrators had to say, guys, you have to step back a little bit. But everybody was very anxious to help out. Okay, so now we come a little bit to the politics of it, because it's kind of a fascinating story. When these things happen, who's in charge? And I would gather that if it happens in Haifa, you're in charge. Is that correct? Okay, all right. Or I would imagine that maybe the military is in charge. But in America, we have many, I know we have a bureaucracy unlike here. So there are many agencies. There's FEMA, which is in charge of emergencies. You'd think they would be in charge. There's the military, right? The Army was all over the place. I've never seen Humvees and tanks on the FDR Drive before, although in the 70s they could have used them, I'm sure. You have OSHA that's responsible for safety and health of workers, and you have the EPA that's responsible for setting air levels. Then you have the state and the city agencies. You would think that one of these would be in... This is not the case here, no? Good. You'd think that one of these would be in charge, but you know who was in charge? The lead agency was a very small agency for the city, because Giuliani was a very powerful mayor, and it was called the New York City Office of Design and Construction. They were in charge. So actually, that's why I asked you if you would be in charge, because the city was in charge. And I'm sure you all remember that Christine Whitman, who was the head of the EPA, she got up and she said on September the 14th, the air is safe to breathe. And after saying that, she was sued, and she was even worse than being sued. She was on 60 Minutes, which is much worse. That's real punishment. So what was the reality? The air was not safe. And there was asbestos, there was particulates, there was lead, there was mercury, there was dioxins, and there was PCBs, and there was every known substance that you could imagine, including things like barium in the air. It turns out that there's barium in the earth of Manhattan, right? Because I wondered for a long time why there was barium. It got churned up into the air. Okay, so why did, people think that the president is evil. I'm not talking about this president. But they think that the White House administration deliberately did this and deliberately misled people for no reason at all. I don't believe that's true, and I have a lot of experience with this. There was actually a panel put together, half Hillary Clinton and half Bush people, if you could imagine, and we were able to work together and come up with some recommendations until they shut the panel down. But so why were people misled? And the patients are angry. Can you imagine you're dying or you can't work because you have asthma and you know that what you were told is not true? Why did this happen? And there's a few reasons, I think. First of all, it was very important in America at the time to get back to normal. The whole drive was to get back to normal. Even more importantly, as usual in America at least, it was the economics of it. And the stock exchange is located downtown and Wall Street is located downtown. And I think the big fear was that if they didn't get everything open and back to normal quickly, the economy would fail and we'd go into a major depression and it would be terrible. So as a result of that, the EPA statements were monitored by the White House, and there were some changes made, and that's how they came out with the decision that things were safe, which we know now is not true. So I'll go through this quickly because I don't want to take the mayor's time, because then I'll be in trouble. They'll revoke my exit visa or something. Okay. Shimon Peres offered me 3/4 of his time. So there are some health concerns early on. The workers, if you look at who's exposed, the fire department was the most exposed. Then come the iron workers, the construction workers, the first responders. And then there's a few people that live downtown. They live in Lower Manhattan. There's 100,000 of them. And people forget that that's a place where people lived. So within a few weeks, we started to see shortness of breath. We started to see chest pain, irritation. We started to see reflux. We started to see cases of eosinophilic pneumonia, all the things that you'd expect with these kinds of exposures. Then long term, I'll tell you a little bit about it in a second, but there was a big fight to get money in order to study these things. But long term, we started to see other things. We did a study at NYU that showed the first cases of sarcoidosis. We started to see cancers. Now we're seeing a lot of cases of autoimmune disease. And we just reported on the first cases of neuropathy. We're actually doing bench research, because you can still get the dust. Dr. Paul Leoy in New Jersey has he saved the dust, and if you want to do research using it, you can get a hold of it. So we were perfusing rat nerves and actually showed nervous system changes from the dust. Okay, so after a long argument and a lot of political maneuvering, we got $4 billion, but it wasn't easy. So right now there's a medical monitoring program in place, and there's 60,000 workers and residents followed, most of whom have very significant disease. They're using the model based on research to care model, and also there's a great deal of outreach, because even to this day I get new patients, and I say, didn't you know that you were eligible for this care? And the answer is no. So there's a lack there. There's a huge, if you want, you can look at the database. There's a huge amount of papers. I think it's up to 500 papers now studying the effects of 9/11 on health. There's a committee that makes recommendations as to what's covered. And right now what's covered is asthma, GERD, airway diseases, COPD, and 30 cancers. Now the cancers weren't initially covered, and this is what I want to talk a little bit about, because my esteemed colleague and my friend Dr. Amster showed a bunch of studies, and that makes you think that policy is based on science. And what I learned the hard way is that policy is not often based on science. Policy is sometimes based on policy, but my mentor, Dr. Selikoff, always taught us that policy should be driven by science. But we'll talk a little bit more about that because it's confusing. So I want to talk about the cancer studies a little bit, because what we started to see was people coming in with cancer, and if I read the newspapers correctly and listened to Dr. Amster correctly, we don't know if that's scientifically true, and we don't know if that's true in Haifa as well. We may know that there's more cancer, and we may know that there's pollution, but we don't know if the pollution caused the cancer. And I think that's part of what we need to talk about today, is how much science do you need to bring out that truck to block access to the place? How much science do you need to change policy? So we have 60,000 people that we're studying. And this data is from 2 weeks ago at the latest WTC research meeting. So for all sites combined, you have a 10% increase in cancer at least for the three different populations. 10%, 14%, and 6%, but if any of you are epidemiologists in the room, you'll see that the confidence intervals include 1. It's not really significant. That's true for most of the cancers, except for one, I think, except for prostate, basically, right? But then you could make the argument that the reason that we're finding more prostate cancer in responders is because we're seeing them every year and we're doing blood tests, and it's being found earlier. So what does that mean? This is what it looked like, by the way, very close to my house. And it's not the winter. It was 80 degrees. That's all dust containing the things I talked about. That means that the scientific evidence that we see does not support the idea yet that the substance causes cancer. Yet the federal government has made the decision to cover the cancers. Now, why did they do that? Did they do that for political reasons? I don't think so. And I'll tell you why I think they did it. And I was a very strong scientist, epidemiologist, researcher by the book, that until something is scientifically proven, you don't change anything. And in our field, we have a lot of public meetings. That's meetings like this, actually. We go and we present data, and we take questions, and the newspapers are there, the cameras are there, and it's very similar. And I went to a public meeting about cancers in 9/11, and we presented our data, and we had the first study that showed that myeloma, which is what you would expect would be a problem first. You would expect the blood cancers first. Myeloma was occurring at an earlier age, but there wasn't evidence yet that it was occurring in greater numbers. So then everyone's arguing back and forth. Well, maybe it's at an earlier age because you're seeing these people and you're finding it earlier. So the scientists are arguing, and this very, very skinny guy gets up, and he doesn't have any hair. And he says, I was a cop downtown. I was down there for 9 months, and I have leukemia, and I'm dying, and I don't have insurance. And I'm very, very, very happy that you guys are studying this, but by the time you'll figure it out, I'll be dead. Okay? That's why the policy changed. So what did the government do? The government took a list of every chemical that was possibly exposed down there. They took that list and compared it to the database of what cancers are caused by those chemicals. Any cancer caused by any of those chemicals is covered. Covered means this. Covered means everything is paid for. It's not like in Israel. If you don't have insurance in America, you basically can't get treated. Or you can get treated, but you don't get the same kind of treatment. Treatment is covered. Medication is covered. Because even if you have insurance in America, you may not be able to pay for your medication. I've had patients, by the way, and that's one of the reasons I love Israel, and I love Israeli medicine. I've had patients that cut their blood pressure medicines into 3 parts because they can't afford to get it every month. They can only afford 10 days with. So anyway, all medication is covered. You're also eligible for a cash award from the Victims' Compensation Fund, which is a $2 billion fund. But I can tell you, most of these people wish they weren't collecting the compensation, and many are totally disabled. Okay, so, what does this have to do with what Eric was talking about? I think we could talk about the lessons that we learned and the preparations for future events. So these are some of the recommendations we came up with in America, and they may apply here as well. It might behoove you to have a standing task force of health professionals to try to deal with public health needs. So I don't know whether you did or you didn't, but you have plenty of experts here at Rambam, and you might have an advisory committee to look at pollution and the effects. Okay? Utilize international resources and expertise. You should have mechanisms in place. What we did a lot of after 9/11, and it's for another lecture actually. Next time I come back, I'll tell you about the Deutsche Bank building deconstruction. We set up continuous community air monitoring so that we knew what levels of everything was happening. Unfortunately, we didn't get them set up for months after 9/11. In retrospect, that would have helped us. Okay, because don't forget what people were doing. People are funny with toxins. They heard there was asbestos. They started measuring for asbestos, and they were in high levels. Now, asbestos takes 10, 15, 20 years to cause disease. It's not the asbestos that was the big problem. It was everything else. But when the asbestos levels were okay, everyone said, don't worry. So you really need some expertise to tell you what to look for. We talk about bioterrorism. With the community, open lines of communication. I used to go to speak to the community at forums. I was asked to come advise people, and at my first meeting, it was about 3,000 people, and the EPA was there, and the EPA said, well, all you have to do is go to our website and you'll see all the numbers, and you heard one voice. It's like, Kol Yisrael. One voice yelled out, we don't have internet, because there was no power and there was no internet. So that doesn't endeavor a lot of trust. Cleaning protocols, having appropriate PPE, and having baseline measures. Workers' preparedness, training, protective equipment, and medical monitoring. All right, I'm going to finish, but I want to close with a story. Can I have 30 of your seconds? I want to tell you a story, and I'd like to invite you. One of the things that I do every few months, and your spokesperson came with me actually last time, I have the honor of taking Israeli veterans who've been wounded or who've been traumatized through an organization. They come to America for a week of therapy and talking, and there's also some social events. So I was asked to escort them to the museum and to Ground Zero, both to show them that we share a fight against terrorism, and it's also very interesting. So the last group that I took, there's what's called the survivor tree. There's one tree at Ground Zero that survived, and it's a big thing. Everyone meets at the survivor tree. One of the soldiers was looking at it, and we were explaining what it was, and he looked at me. And he said, I understand what it means. It means that from destruction can come something new, can come hope. And what we're hoping is what we learned from those terrible days will somehow help other people to avoid further problems. Okay, thank you.